Good morning to you all. I would like to welcome all of you to our very first IDD Town Hall meeting. My name is Angela Holt, and I'm the CEO of Middle Flint Behavioral Healthcare. I've been a part of this agency for over 18 years, and I am passionate about what we do here. So passionate, I want everyone to know what we do.
Hold on one second.
Middle Flint's IDD service connects us with some of the most vulnerable community citizens and their families. We believe that all citizens in our communities are entitled to meaningful services that promote independence through integrity, normalization, dignity and respect, efficient services, planning, enhancement of individuals' abilities, networking with the community, development of individual services, environments that are clean and safe, natural supports, confidentiality, and employment opportunities. Our vision is to create an organization that is recognized by our community as a quality investment dedicated to making a difference in the lives of individuals and families within our community, that values its employees and is well managed. Although I've been a part of Middle Flint for 18 years, as I indicated earlier, I've only been the CEO for the past 11 months. As a new director, one of the areas of improvement I identified early on was that no one really understood what Middle Flint did for their community. To me, that's a problem. So I set out on a mission to enlarge Middle Flint's imprint on this community. I've begun by meeting with community leaders such as county commissioners and city councils. I've also met with healthcare leaders and educators. Now, as we meet with the community at large, I'm very excited about today's events and about introducing you to those that are a part of the professional and compassionate team that works together tirelessly to support our communities. I'm also excited to share with you who we are, what we do, and how we work to have a positive impact on the communities we serve. Middle Flint Behavioral Healthcare has an almost 50-year history of mental health, substance abuse, and developmental disability service to Southwest Georgia. Established in response to individuals' need for services in place of and after release from state psychiatric hospitals, the organization, then known as Personal Services Center, operated for several years under the management of public health. In the 1970s and 80s, the Personal Services Center grew, establishing many new programs. While continuing to focus on adult mental health and developmental disabilities, the organization also established a community detoxification program for individuals with substance use disorders and a child and adolescent counseling program during those years. In the mid-1999s, significant changes occurred in community behavioral health care. As a result of new legislation, community mental health centers in Georgia were reestablished as community service boards, operating under the new governance of boards representing the counties of each service area. The new organizations moved from the oversight of public health to a contractual relationship with the Division of Mental Health, Developmental Disabilities, and Substance Abuse. In 1994, the 8-county service organization was established as a community service board and reborn as Middle Flint Behavioral Health Care. The Department of Behavioral Health and Developmental Disabilities, referred to as DBHDD, began operations in July 2009, replacing the Department of Human Resources. DBHDD was created to solely focus on supporting the well-being and independence of those with behavioral health issues, developmental disabilities, and addictive disease issues. In September 2017, Middle Flint Behavioral Healthcare was assigned the responsibility of overseeing the restructure and establishment of needed service in what was then the Phoenix Center CSB program. Mental health, addictive disease, and Developmental Disability Services in Houston, Crawford, and Peach counties became Middle Flint Behavioral Health Care's responsibility. New programs were established and existing ones were revamped. On July 1st, 2019, Middle Flint Behavioral Health Care officially gained the 3 new counties, creating what is now an 11-county service area that includes Crawford, Crisp, Dooley, Houston, Macon, Marion, Peach, Sly, Sumter, Taylor, and Webster counties. Middle Flint Behavioral Health Care has made significant strides throughout its history and continues to serve as a leader in the field of behavioral health, addictive disease, and intellectual and developmental disabilities. The agency looks forward to its continued partnership with the state in the provision of safety net services to those most in need while continuing to diversify the services provided and individuals served. The next decade promises to be one of continued change with new service opportunities. Again, I'm excited about everything we're doing here at Middle Flint, and I'm excited about sharing that information with you all this morning. At this time, I would like to introduce the next speaker as Kerri Roberts. She's our newest member of Middle Flint's executive management team. She oversees our IDD services. With her, she brings 15 years of leadership experience and nearly 10 years in the human services industry. So at this time, I thank all of you for your participation in our first town hall, and I turn it over to Kerri.
Good morning again, everyone, and thank you, Angela, for the introduction. Just a few housekeeping instructions to discuss before we move forward with the remaining presenters and myself. Everyone will be kept on mute during the live event to reduce outside noise and prevent distractions. Also, if you have any general questions that you may have during the live event, there's a chat option available inside Microsoft Teams. At the end of all the presenter times, we'll have a reserved period for Q&A to discuss and answer those pertinent questions. At the end of the live event, after everything's been completed, we're going to randomly select recipients to receive gift bags, our prizes that were referenced for this event. These will either be mailed or delivered to the location selected. If you have any individual specific questions, I encourage you to reach out to me directly or someone on my team after the meeting. It may be about a person specifically. I'll post my direct email and contact information as well as some of the other leaders within our group. We hope you learn a lot about our program and offerings within your community, and we hope this is the first of many informational sessions that we're able to have the opportunity of hosting. Again, I'm extremely excited to be here today and introduce myself and share more information on our intellectual developmental disabilities program here at Middle Flint Behavioral Healthcare. We are a local community service board, as Angela previously discussed, and I'm the director for our IDD program, Kerri Roberts. A little bit more about me for those that I haven't already been fortunate enough to meet. I'm relatively new to the world of IDD and come from working in the world of elderly and childcare for the last 10 years. Every day, I'm excited to continue to learn more about the resources available and ways to continue to improve the ways we can help in our community. Today, I will be discussing details about each of our programs, providing a little bit more information about our service coverage area, explaining how our department has been newly reorganized, and going over possibilities for future growth within the counties that we serve. Currently, Middle Flint Behavioral Healthcare covers an 11-county region within Georgia. This has increased, as Angela discussed, within the last few years to include the service region that was used to be the Phoenix Center here within the Warner Robins area. The current counties that we provide service coverage to should be shown in the PowerPoint. Each county doesn't currently have its own Middle Flint location, but we do offer services and offer support with those services within all the coverage area. Currently, the services offered are residential services. We offer host homes, day center services, community living supports, supportive employment or pre-vocation, and family support. I'll be providing more information about each of these services on the next few slides. A large part of our current program are 24/7 residential homes, also licensed as community living arrangements or CLAs. Currently, we have 8 homes that house 3 to 4 individuals within the area. Middle Flint Behavioral Healthcare currently has properties located in Americus, Warner Robins, and Fort Valley. Each site is staffed 24 hours a day by trained, qualified caregivers that provide support to our individuals in a home-like setting. Our caregivers assist with activities such as bathing, dressing, eating, and also transportation, and lots of other things. Our care staff also work closely with our individuals towards reaching individualized goals as defined by their care team. People often live in these homes their whole adult lives, so we work really hard to make sure each of the homes for these people feel extremely personalized. The next program type we provide services for are called host homes. Currently, we only have 1 active host home provider that provides service to 2 individuals. Our host home services also provides care in a 24/7 setting, and they also assist with activities of daily living. This is one of the programs that we hope to continue to expand and be able to offer more care services within our service area. In addition to the residential program, we also offer a day service program, also known as Community Access Group or CAG, here at Middle Flint. We currently have 3 day service centers that operate Monday through Friday. Our day service centers are located currently in Sumter, Taylor, and Crisp counties. These programs offer individuals and their families transportation to and from the facilities to make participation for our individuals easier. Activity programs led by trained instructors are also a part of the everyday of the centers. We also work to teach the individuals skills, and they also work to reach individualized goals geared toward helping them increase their independence. Our day centers work in collaboration with our individuals to offer a program called supportive employment. There's also a phase in that I've come to learn called pre-vocation. This program allows our individuals to go out into the community and gain work experience and skills with the support of a worker from our center. Our team works to identify individuals' vocational skills and interests and develop and implement a job search plan to obtain competitive employment in an integrated environment for that individual. Examples of some of the places that our individuals currently get to work are local DFACS offices, local school systems. We have some individuals that perform yard maintenance. We even have one of our teams working at a Secret Service on a Secret Service contract in Plains, Georgia. So that's pretty amazing. Another one of our programs that we offer that allows an individual to stay within their home and receive caregiver support is called Community Living Supports, or our CLS program. This program pairs a caregiver with an individual that can assist with areas such as personal care tasks, or they may act as a companion or sitter for that individual. Examples of tasks performed may include assistance with transportation to and from medical appointments, assistance with other activities of daily living, including dressing, toileting, etc., meal preparation, or management of household chores. Lastly, but not leastly, our family support program is a program that we currently have for individuals that are of younger ages, but also it's ages 3 and up. Family support is a program that assists with an array of goods and services aimed at providing families with individualized support that they need to care for a family member with disabilities at home. Family support funding is designed as a funding source of last resort, with efforts to secure funds from other resources when efforts from other sources have been unsuccessful. Stacy Rexroth is the coordinator for this program and can assist with providing applications and more details about the program to families that may be interested in inquiring about more details. I will also be providing Stacy's contact information later in the presentation. I'm also very excited to announce that we've had several big organizational changes within our team over the last few months. Our most recent change is the addition of a full-time registered nurse that will assist in various ways throughout all our programs. We're excited to welcome Debbie Borden to the team. Also in September, Ebony Thomas, our new South Residential Coordinator, and Shanita Brown, our new Supportive Employment Supervisor in Sumter County, were promoted internally and started new roles within the organization. Ebony's promotion was significant as it divided the team regionally instead of by program type. Since we are so geographically separated, I wanted to separate the counties into two roles that would have coordinators that act as liaisons and assist with much needed consistency in both our residential and day center settings. Our interim residential coordinator, she was interim in 2020 to beginning of 2021, Latrina Avent, was also promoted as the North Regional Coordinator. We are truly thankful for the additions and also for the longstanding members of our team, and I feel confident with these leaders in place, we will continue to be able to offer great services to the individuals that we serve. Just a little bit about some of the ideas for future growth within our department. Our future goals for the IDD program include increasing our ability to provide more services to the individuals within our catchment area. We are hopeful that we can, for the possibility of more host homes to be able to serve more individuals, an additional day center in our northern counties to be able to provide services there, and nursing services, of course, within our residential homes. Next, I've added to the presentation slides my contact information as well as that of our two regional coordinators, both North and South, and our family support coordinator, Stacy Rexroad. We will all be happy to answer questions if you have any, or maybe even try to point you in the right direction if that's the case. Please feel free to reach out at any time. I'll also add these contacts and the emails to the chat for you to write down if you're unable to see the presentation at this time. I'd now like to take the opportunity to introduce our next speaker, Ms. Susanne Roquemore. Ms. Roquemore is a well-respected, long-standing member of the Middle Flint Behavior Healthcare Board and has been with the board for over 25 years. Ms. Roquemore is with us today to discuss her family's personal COVID-19 vaccination experiences. Please join me in welcoming Ms. Roquemore to our town hall today.
So sorry. Okay, so sorry. Here I am. Okay, am I on now? Can you hear me? Okay, good. All right, I'm sorry. I'm Susanne Roquemore, and we have a son with special needs who attends the service center, DD Center here in Americus. He is 46 years old. He has several disabilities. So that's why we decided to have him vaccinated. While I'm talking to you, there's a slide that has been put up about some of the reasons why we decided to get Scott vaccinated, which was to kind of keep him with his normal routine and to keep us with our normal routine. He's not a cooperative patient because he doesn't really understand why he needed the vaccine. That's why we decided that the vaccine was best for him. He won't wear a mask. We are worried that it would hurt his breathing capabilities, so he doesn't wear a mask. He wouldn't understand the mask. Before we got his vaccine, the mask was his only protection, and we wanted him to keep going to the center because he needs a regular routine like most of our clients at the center do. It helps to get him out of you can't stay in your house 24 hours a day unvaccinated. Well, we couldn't. He had no side effects. My husband and I also got our vaccines. We didn't have any side effects. We had to, our arm was sore like we had the flu shot. We had to wait 15 minutes to make sure that we didn't have any reaction. He got the Pfizer. We both had the Moderna. Even though we have had the vaccine, though, there's always a possibility of getting COVID from an unvaccinated person or one who is not showing any symptoms. That's why another reason we decided that the vaccine was best for us. We spoke with Scott's care provider, our care provider, and he decided along with us that that's the only thing we really could do. It would be, we just couldn't see Scott in the hospital. So anyway, he's now riding the van home, and we're happy with that. They keep them very separated. They're very when you go out there, you can smell they've been cleaning. Most of the clients are wearing a mask. I teach school, and the children are too young to receive the vaccine yet. So that was another way that we could possibly have gotten COVID. We have young grandchildren who are not able to be vaccinated yet. So the whole thing about the vaccine is we were very concerned about it. And you have to talk to your care provider. You have to speak to them about what's best for you and your family member. And for us, that was our best alternative if we wanted to continue taking Scott to church, taking him for a walk, letting him go to the center, letting him ride the van, and to be around other people. And that's what we have done. We've been very happy with our decision. It's almost time for Scott to have his booster shot, and I'm assuming we'll be able to go to Clinic Drugstore and get the booster shot as soon as possible. But all in all, I will say that you have to talk to your own care provider. You have to discuss it among yourselves. But for us, that was the only thing we could do. That was our best option. If you have any questions, of course, I'm always available. I think everybody has all of my information. It's even on the website. I've been on the board for many, many years, and I care about all of our clients, not just my own personal one. However, I do care more about him. I want to introduce our next person, Ansley Evans. She's a risk management director, infectious disease control nurse, and the HIV nurse. She has been with Middle Flint for 9 years and has worked in many different programs, including at one time being the interim IDD nurse. She will be speaking to you today on the different ways Middle Flint is fighting COVID-19. Thank you all for having me.
Good morning. Thank you, Ms. Susanne, for that introduction. I just wanted to speak to you all today just on some of the ways that we are fighting COVID-19. Along with the rest of the world, it kind of caught us off guard about 2 years ago. We were, as our own CEO has said many times, building the plane while we were flying it. And we were trying to keep up with what every news organization said, and we just wanted to make sure that everybody was as safe as possible. We have implemented many different policies since the start of the pandemic to keep everybody safe, including the COVID-19 screening tools. Before you enter any building at Middle Flint, you are required to have your temperature taken and to fill out a screening tool and to ensure that you have no symptoms of COVID-19 that are active. PPE is available at every single location. We actually have learned from last year that we can never have too much PPE on hand. So we do actually have an emergency stock in case there is another shortage of PPE. That includes gowns, gloves, cleaning supplies, masks, hair covers, shoe covers, face shields, hand sanitizer, bleach, Lysol, anything that we can use to make everyone feel safe and to kill germs. We actually have an infection control class that our staff is mandated to attend annually, where we teach staff how to properly put on PPE as well as take off to reduce the spread of germs. If we are required to wear that type of thing, for example, we had a quarantine home last year with one of our DD homes were quarantined with COVID-19, and all the staff in that home had to don and doff PPE before they went in, and that was full head to toe gear. They did a wonderful job. We actually are now requiring all of our staff to know how to do that properly. We monitor current CDC and Department of Public Health guidelines for updated protocols and policies. And we do that on a weekly, if not daily basis. We get emails from the CDC and Department of Public Health daily. We are trying to keep up with every single thing that we need to do. As Ms. Susanne said, our vans are cleaned after everyone leaves them. Our different doctor's offices are cleaned after every client is in there. We have set up vaccination days to make it easier for our staff and our individuals to be vaccinated. And we actually held one yesterday that was extremely successful, and I'm very excited to say that we had a very big turnout for that. So that was very exciting. And speaking of vaccines, I'm actually going to throw it to Dr. Faith Pinnell. She is a frontline worker serving as a pharmacist at Clinic Drug Store in Americas. She has 20 years total experience in the role and has spent the last 10 months of the global pandemic educating the citizens of Sumter County about the benefits of COVID vaccination, while also administering the vaccine to her drugstore patients. In her free time, she works as a consultant for Middle Flint Behavioral Health Care and hosts both COVID and influenza vaccination clinics at local businesses to help keep her community both informed and healthy. Dr. Faith Pinnell.
Good morning, and thank you, Ainsley, for inviting me to be a part of this panel this morning. I feel like I spend my days talking about this vaccine, so I'm happy to do so today. But before we talk about the actual vaccine administration, I just want to reiterate to everyone the benefits of vaccination itself. So by getting your COVID vaccine, you are helping to slow the spread of coronavirus. These vaccines are safe and they're effective against you yourself contracting COVID, and then you spreading it to your friends and your family and the general public that you come in contact with. They're effective against COVID and now the COVID Delta variant that is so dangerous that we're hearing about now. So it's still possible to contract COVID if you've been vaccinated. You all know that. But what we also know is that if you have been vaccinated, that vaccine is going to help you get better faster. You'll have a shorter sick time if you're fully vaccinated. And it's going to help you keep that COVID infection at a mild state rather than it progressing to a more serious infection and illness. And finally, we know that COVID vaccination prevents hospitalizations. We know that it keeps patients off the ventilator, and we know that it cuts down and prevents COVID-19 related deaths in general. So please consider, starting or completing your vaccine series if you've not done so. Certainly, as Ms. Susanne said, everyone has fears and concerns, and I'm always available to talk you through those or address those when needed. So moving on to vaccine administration. There are 3 vaccines available on the market at this point. All are given by IM injection in the upper arm, the deltoid muscle of the upper arm. So there's a vaccine by Pfizer, one by Moderna, and one by Janssen, or you may have heard it called Johnson & Johnson. So let's go through those individually. Okay, so the Pfizer vaccine is a 2-dose series, and those 2 doses are given 21 days apart, okay? It's indicated for patients 12 years and up, so it's the only one that can be given to adolescents. And it has a 95% effectiveness against preventing COVID infections. So that's Pfizer, okay? Moderna is similar. It's also a 2-shot series. It just repeats in 28 days, those 2 doses do, instead of 21 days like Pfizer. It's indicated for ages 18 and up, so adults only. And it has similar effectiveness. It's 94% effective against preventing COVID infections. So the 3rd vaccine is the Janssen or Johnson & Johnson product. It is the only one and done. It's the only 1-shot series. Now, its effectiveness percentage is lower at 66%, but that's still acceptable according to the FDA. And what we've been told from the very beginning of this pandemic is get the vaccine that's available to you. Get protected against this virus, okay? Again, it's indicated for individuals 18 and up only. The patient groups that I would recommend this product to are maybe those who have an intense fear of needles. You know, you're concerned that they might not return to get that second dose that provides their full protection. Or maybe patients that are not going to be available to return and get their second dose. I vaccinated a lot of migrant workers who might be returning home before that 21 or 28 day period comes around. And I really wish that I would have had some Johnson & Johnson vaccine on hand so they were fully vaccinated before they left our country. So moving on from administration to safety, because that's such a concern and keeps people from getting the vaccine. Really safety and more so side effect profile. Again, we'll talk about each brand, but really the side effect profiles are similar across the brands. So I'll talk about them in general and then point out a couple of differences. So with the first dose, the chief complaint that we hear from patients is simply a sore arm. And you're really going to have that with any IM injection or any vaccination. This one may be a little bit more intense, but it resolves quickly and certainly can be treated with ibuprofen or Tylenol when that happens. So the second dose, or the chief complaint that we hear from patients about that truly onsets the day after they receive their second dose. And what we hear from patients is this: they have headaches, they have a slight fever or chills, they're tired, they're achy, right? Their body aches and their joints ache. But again, I think the best way to deal with this is to educate patients ahead of time so they're not fearful of what might happen. Just go ahead and tell them what to expect. And these are things that we just treat with ibuprofen and Tylenol, and reiterate to the patient that it doesn't last long. It usually resolves within a day. So it onsets the day after the vaccination and then resolves the following day. And of course, you're going to see all of those things combined in the one-shot Johnson & Johnson vaccine administration. So switching from side effects to safety concerns, we could probably talk about that for a whole hour, but I just want to address a couple, and that is the impact on fertility, right? Because this fear is what's keeping our adolescent age group from being vaccinated, and there are absolutely no studies that show any impact on fertility. That is a social media myth. So please, if someone speaks to you about that, refer them to a healthcare professional that can really go over the evidence or lack of it about that issue. And then I want to reiterate, it's also being recommended by our OBGYNs to give to pregnant patients and those who are nursing. What we do know is that those patients have more serious illness from COVID than normal patients do. So they need that vaccine protection to help them through that illness should they contract COVID during their pregnancy. Okay, so what's next for vaccines? And you probably know the answer, right? You've all heard about booster doses that are becoming available on the market now. So again, let's take them brand by brand, okay? Pfizer. So those booster doses are already available. They are available to most people considering some attention to risk factors and disease states, but most people 18 and up. So they're not indicated for the 12 to 16-year-old population. But for most people 18 and up, they are available 6 months after the second shot. And it's really just a third dose, okay? It's nothing different. It's just simply a third dose of the vaccine, same as you got the first 2 times, okay? Moderna's next. So you probably all watched the news this week. That's been in the headlines. So the FDA is in the midst of finalizing their recommendation to approve the Moderna booster The CDC is next. Both have to sign off, and we expect that to happen early next week. Okay, we don't know the exact details. What we expect is, again, just be a third dose. It perhaps will be half the dose those patients received versus, the full dose was shot 1 and 2. It might be only 65 and up to begin with, probably 6 months after the second shot as the Pfizer booster dose, but all that is to be determined next week. Just stay tuned and watch your headlines and contact your health professionals if you have a question. And finally, that leaves us Johnson & Johnson. So the answer is not yet, right? We expect that a booster dose will be recommended for that product, but it has not been presented to the FDA and CDC. That application has not been presented yet. So just again, stay tuned. So I just want to reiterate the importance of vaccination. That these vaccines are safe and effective, and it is what you can do to keep yourself, your family, and your community healthy. So guys, thanks so much for allowing me to just speak about this topic that I spend day in and day out dealing with. And I will now turn it over to Matthew Almeida. Matthew is the Chief Operating Officer and Corporate Compliance Officer for Middle Flint Behavioral Health Care. He is a 10-year Navy veteran and has 25 years of operations management and compliance experience. Matthew is passionate about providing quality service and top-notch facilities for our clients and their families, and he enjoys spending time on the units. Matthew?
Good morning, everybody. First, let me just say it's an honor and a privilege to be able to be here with you and just spend a little bit of time with you all this morning. I certainly appreciate the opportunity. One of my many jobs with Middle Flint is to oversee the policy and procedure and the upkeep of our facilities and transportation management. And so I wanted just to talk to you a little bit about that this morning and share some of the things that we're doing to support the team that allows to be able to provide services to you all. We are their support team is what I was trying to say, sorry, to help keep things moving and provide you the excellent services that they provide for you. So today I'm going to discuss just a few of the things that we're doing to keep things moving and to keep you all safe and to keep our facilities in top-notch condition. And the first one and the biggest one that I want to bring up is the move of our Sumter DD program. They are currently located at 523 US Highway 280. And recently the owner of that building has decided they wanted to utilize that building for other services. So we were challenged with having to move that program. So we are in the process of renovating a building, putting in all new carpeting, flooring, making it super nice so we can relocate that program. And they're going to be going to 120 North Dudley Street, which is the old administration building. And we're really excited about that move. The Sumter DD program, that facility has been needing a little bit of work. So we're excited to be able to bring a much better updated facility to our clients and their families to be able to provide better services. It's a much better location that provides better access to the community and some of the different areas of the community, and much better access for our clients and the family. So we're excited about that. We're planning on making that move happen around the 1st of January, around January the 3rd. We've still got some work to do. Some renovations are still going on. We want to make sure everything is top notch before we start moving our clients. So that'll be happening again around January the 3rd. So more detail will come with that. I'll be talking with Kerri and her team, and we'll be getting some more information out to you all about that, those of you that participate in that program and the programs within that facility as we get closer to that move. One of the other things that we work on very hard is our group homes. We've got several group homes that you may or may not be affiliated with. The upkeep and maintenance of those homes is very important to us in operations. We're constantly doing preventive maintenance and inspections and looking and upkeeping to try to make sure that we're providing the best facility possible for your loved ones to be in. Some of the things that we're currently working on in our group homes is increased security, whether that is security lighting. We're working on alarm systems in some of our group homes. We're working on integrating security camera systems in a lot of our group homes in phases. And we continue to look for new properties to increase our footprint within our catchment area to have more DD homes available to provide increased services. So we're constantly doing that as well. And then the last thing that I wanted to just throw out there is transportation. You know, transportation is a huge part of the services that we provide, and being able to get our clients from point A to point B and to get them to the services that we provide. So clean and maintained vehicles is very important. We have a fleet manager, Mr. Morris Williams, that works very hard to make sure that our vehicles are maintained, that our maintenance is upkept, that we stay on a preventive maintenance schedule. We work very hard to make sure our vehicles are clean. We do spot checks on all our vehicles to make sure that your loved ones are getting in clean vehicles. Like Miss Susanne said, and some of the others on the panel, we try to go behind every day and clean and disinfect and make sure that our vehicles are ready for the next day's use after our clients use them on a daily basis. And just availability of transportation. We are currently going through an audit of our vehicles and our vehicle use to make sure that we are utilizing our vehicles to the best of our abilities to provide the best services that we can, and just to make sure that we can provide you all the transportation and the programs of transportation that they need to be able to provide services. We try to provide all the PPE and masks and all the things on the vehicles that are required to keep all our clients safe. All our drivers are required to wear masks while they're in the vehicles. And again, we're just going above and beyond, trying to do everything we can to make sure that your loved ones are protected and safe while they're in our group homes, in our facilities, and on those vehicles. So we go try to do that and keep tabs of all of that. So we do everything we can, again, to make sure we can provide, or our IDD staff can provide the best services possible, and to make sure that your loved ones are safe while they're within our care. That's very, very important to us. So with that, I'm going to turn it over to our next presenter, who is Miss Valonda Baldwin. I know she's excited to be able to share with you all. Miss Valonda Gray Baldwin is the Regional Service Administrator for Intellectual Developmental Disabilities at the Region 6 Field Office with the Department of Behavioral Health and Developmental Disabilities. Valonda obtained her Master's of Education in Counseling and is a board-certified counselor. She has 20 years of a combined experience, with 15 of those years serving individuals with intellectual disabilities and 5 years serving as a therapist on behalf of adults with severe and persistent mental illness diagnosis. Valonda presently leads the Region 6 Field Office, primarily working to ensure that individuals have and maintain easy access to high-quality services. She collaborates with a vast network of service providers throughout the 31 counties in Region 6 to resolve issues and/or barriers that pose imminent risk to individuals' health, safety, rights, or hinders access to the broader community. Additionally, Valonda regularly conducts information education sessions for the school system, community agencies, and law enforcement on navigating the IDD service system. Please help me welcome Miss Valonda Baldwin.
Thank you. And first, I want to make sure, can everyone hear me? Great. Good morning. Thank you so much, Matthew, for the introduction, and thank you, a huge, tremendous thanks to Middle Flint for welcoming DBHDD to the town hall this morning. Today I am here, I was asked to discuss the service application process for accessing services through the Department of Behavioral Health and Developmental Disabilities, specifically for intellectual and developmental disabilities. We often throw around a lot of acronyms, and so whenever we say IDD, that is what we're speaking of. So if you see on the screen, you'll notice there is a website. This is the link to connecting families and individuals who are able to access, who have internet access and can get online to apply for services. We have 3 different routes for varying levels of access to technology. Some people are fully equipped and can get online and submit their applications online and go forward. Others may not have access to computers at all. So that is why we have these 3 different routes that all end at the same, you would think I would say finish line, but it's actually a launching point. So we have 3 different methods to apply that ends at the same launching pad for access to services. So I'm going to be talking primarily about the online because it's so new and it's linked to our broad-based IDD Connect system and integrated into that system so that when you apply, you're actually accessing and entering or uploading your documents within our IDD Connect system. But I do want to spend a little bit of time just talking about the other ways for people who don't have access to computers. We still have the traditional method for applying, which is where you contact our office. You can either do that by phone or by email. Contact our office and request an application packet. We can put an actual paper copy application packet for IDD services in the mail to the address that you provide. If you have access to email and you want to receive an email soft copy or electronic copy of the application, we can send it to you, the application packet that way. You would complete it. It's just a 2-page application, but the primary meat or substance of the application is the required supplemental documents. And if you see on your screen, these are all the supplemental documents that we will need. So you would print that, that electronic copy, add your supplemental documents, and you can set an appointment, either schedule an appointment to drop the completed application off to our office, which is located on the campus of West Central Georgia Regional Hospital in Columbus, Georgia, or you can mail it in. So those are the 2 methods for folks who have either no access to a computer or limited access to a computer. For those who are fully equipped and ready to go with moderate level of experience navigating the internet and uploading documents, this is what I want to spend the bulk of the time talking about. So for families who want to apply and they contact our office and say that I have a loved one who has an IDD diagnosis and needs some assistance with regular activities of daily living, maybe community access, maybe lifelong learning skills. This is the intake process for doing so. So the first thing we would do is we would send you this link to our website. And this link will take you to this page, which tells you, number one, what I mentioned earlier about the meat or the substance of the application is the supplemental records. And these are the supplemental records that we need. Most important, I would say, or most significant would be the psychological evaluation, because that is what our psychologist uses to determine whether or not the individual or your loved one meets criteria for, according to Medicaid policy, program manual policy, whether or not the individual meets criteria for IDD services. So while all of these documents are required and necessary, probably the most significant is going to be that psychological evaluation. So please make sure that when you are completing the online application that these documents are uploaded. And I'm not sure how visible this is. The print screen on my computer is small, but still visible. But I'm just going to kind of go through some of the things. In addition to the psychological evaluation, also important is the official birth certificate. We often refer to that as proof of lawful presence in the United States. If you have a Medicaid or a Medicare card, that's also requested. Developmental education, school transcripts, vocational / support employment records. And just to save time, those are just some of the documents that are required. So once you log into the website or click on the link, it takes you to this page. The next thing you're going to want to do is hit new user, create new user account. So, and that's here. You're going to hit the new user account. It's going to take you here. You're going to create a user ID, a username, and a password. That user ID and that password will allow you to log back in at any time to check the status of your application. So before, you always had to call, or you had to mail, wait for something in the mail, or mail someone or email someone and ask about the status of your application. When you apply online, you have a login with ongoing access to your application status. It will tell you exactly where you are, where your loved one is within the application process. So once you create that user login, you will be able to log in and you will be able to check the status. You will also utilize this portal to upload your documents into the IDD Connect system. So when I mentioned before about the psychological evaluation and things of the proof of the lawful presence, birth certificate, Medicaid card, those are the things that you would be uploading into the system. Those are the supplemental records that our IDD clinical team utilizes to determine pre-eligibility. So I'm going to go on to the next screen. Okay, so from there, you will notice that there are some helpful resources for individuals with developmental disabilities. Waivers programs now in the new options waiver program and the comprehensive waiver program are services of last resort. So once your loved one applies for services and gets determined pre-eligible, the individual may or may not qualify for long-term services right at that moment. So these are the resources that we refer and utilize to provide access to services while individuals wait for longer-term services through the waiver program. So if your loved one is interested in working, we make referrals to the Georgia Vocational Rehabilitation Agency for competitive and integrated employment in a community setting, working alongside other individuals without disabilities. And individuals with disabilities are working alongside of individuals without disabilities and also getting paid minimum wage or higher. So that is what we refer to as competitive and integrated employment. So if your loved one is interested, we make a referral to this resource. In terms of applying for other services, I think it was Kerri that referred to some of the services that are available through IDD, such as community living supports. That's basically supports in the home to assist individuals with activities of daily living, bathing, grooming, dressing, meal preparation, community access, transportation to and from medical appointments. Those services, even though the person may not be deemed ready or where there's funding available for them to access waiver services, those services are actually available through family support. So this is another resource that we utilize while individuals are awaiting funding for longer term services. They can access those services, things like personal support in the home, or what we refer to as community living supports. Also available under family supports is respite. A lot of families need respite. They need a break. Individuals need a break from caregivers, and caregivers often need breaks from their loved ones. So that's what respite is available, as well as a wide array of other services are also available through family support services that mirror the waiver services. They are although they are much smaller in the funding amounts, but they are designed to be a bridge and fill some gaps until that person meets most in need criteria to go into waiver services. Another resource I want to talk about is for youth under age of 21. Any youth under the age of 21 can access, if there are significant medical complexities that the individual is experiencing, they can access the Georgia Pediatric Program for Children, often referred to as GAP. GAP services are available for those youth who have significant or severe medical complexities. And then for individuals with autism, on the autism spectrum, I should say, who are also under the age of 21, adaptive behavioral services are also available. Many of these providers, most of these providers require Medicaid, but if you have private insurance, some of the providers that offer these services through the Georgia State Medicaid benefit plan will accept private insurance. So there are lists of providers available through these programs. These links take you to those resources, and we often refer individuals who are waiting long-term services to these programs as well. And then I cannot forget to mention Parent to Parent of Georgia. I don't know about you all, but this is an awesome resource. I have sat in on presentations from Parent to Parent, and they presented on IDD Services and the service system with DBHDD just as well as a representative such as myself from DBHDD. So I thoroughly support and get behind Parent to Parent of Georgia because they have such a wide array of resources for families and individuals with disabilities, not just IDD, any disability. It captures everything. So these are very critical and important resources to have, and I always want to make sure that families have access to these. I'm going to go back to the application process at this point. And if you will, once you apply for, so I talked about the routes or the methods for applying for IDD services. So then once you apply, what can I expect once I apply to IDD services? So this is actually a web page. I captured a screen from our web page. I think visual aids are just so helpful. And so I captured did a screenshot from the web page. And how do I apply for services? This is actually on our DBHDD website. And if you look at the process, drop down here, well, let me go right back here. It's also, if you notice, this is actually an application for developmental disabilities right here. So this is the application. It's only a 2-page application. It does not contain, you would have to add your supplemental records to it as well. But it is an online version of the application if you just want to see what it looks like. And then, so as far as what to expect once you get into the application process or once you've submitted it, you would submit the application to the nearest field office. If you submit it online, it automatically comes to the field office for us to review and process. So you don't have to worry about bringing it anywhere. That's why I absolutely love, it's the fastest method to apply. And it's it's the less strenuous or less involved, most convenient for families, I think. So once you submit the application, the field office intake and evaluation team will process it. We're basically checking to make sure that all of the required materials are there, all the required records are there. And then once we verify, our clinicians verify that all of the records are there, those records go to the psychologist, who then reviews the application packet and most importantly, makes a determination of whether the person is pre-eligible. Let's say that the psychologist was able to determine that the individual or your loved one was pre-eligible. At that point, the individual would receive a notification in the mail. A letter would be mailed to the individual and their family, letting them know that they are pre-eligible for IDD services. At that point, the family would be contacted by someone called someone from my office called a planning list navigator. In our office, that person right now is Cassandra Lenore. She would contact you and conduct what is called a needs assessment. And no worries, that needs assessment is designed to be conducted over the phone. So you don't have to worry about traveling. You don't have to worry about COVID or covering using PPE to cover up and come to our office. It is designed to be conducted over the phone. That was pre-pandemic, and we did it to make sure that families have the easiest access to our services. So our planning list navigator would conduct that needs assessment over the phone. That needs assessment is going to help us to determine what are the unmet needs of the individual and how quickly does the individual or your loved one need to move into our services. Or sometimes the individual has more needs, more of those needs met and can stay or remain on our planning list with access to those other services that I spoke about earlier, like family support and maybe the autism state plan or GAP services. So those are some of the things, and we make referrals to those services as well as GVRA while the person is on our planning list. So after being on the planning list and getting the needs assessment completed, that needs assessment is going to help us determine what needs or how quickly that person needs to move into services. If the person meets what's called most in need criteria, we assign or award funding for waiver services. If the person is homeless, if the person is at immediate or imminent risk for institutionalization, among other, if they have a sole caregiver who has passed away and that person is completely without any supports, those are some of the high level immediate funding need or most in need criteria that we utilize to say this person must go into services immediately. So then at that point, funding is awarded. We conduct more assessments, nursing assessments, behavioral assessments if necessary. And then we also, not a clinician, but a caseworker, what we call a planning list administrator is assigned that helps the person access waiver services. An ISP or an individual support plan meeting is conducted, and that person, the planning list administrator, assists the individual and their families with selecting service providers such as Middle Flint and various other providers within our network for IDD services. And I just also want to talk about some of the other IDD services that are available. And let me click over to that. So as you can see, these are the waiver services. We have very, very many, a very wide array, a vast array of waiver services available. And as I just want to go back and say again, many, not all, but many of these services are also available under family support services, but just to a much lesser degree. So residential services, group home, host homes, transportation services, specialized medical supplies, like shower, bath chairs, shower chairs, things of that nature. Also respite, community living supports, nutrition services, adult physical therapy, speech and language therapy. All of these services are available and based on clinically assessed need. Once the person has been deemed ready and needs a waiver services, whether it be now or comp, these services are available. And so I want to click back to the application process again, just really quickly, to go back through after what happens once the individual has an ISP completed. Then the planning list administrator submits that ISP for review to our regional field office. It goes through a quick review process where it's clinically approved and a prior authorization is generated, and then the service begins. The clinically assessed services begin. And some people might ask other questions, frequently asked questions when I do this presentation is, how long does this process take? That is a really good question because it can take various different lengths of time depending on the circumstances of the family, the individual, and the records that are being reviewed. So I have seen applications in my over 10 years of being in this position. I have seen application processes take as quickly as 3 weeks. I have seen application processes take as long as 3 months. So just to give you just to give you some perspective of how vast the application process can take. It really depends because it depends on the documents that are submitted. Sometimes the documents that are submitted are not sufficient for the psychologist to make a clear determination. Sometimes the documents are sufficient, but they require further review, and the psychologist will request a clinical interview with the individual and their family member. So it really just depends on various outcomes. So I just wanted to let you know that. And then another frequently asked question we get from when I give this presentation is, when is the best time to apply? While there's no policy or formal or official answer to that, again, from my vast years of experience in doing this work, the best time is to apply. You can apply at any time, first of all, But the best time to apply is when your loved one is entered into high school. First, when they enter high school, because they have access to psychological evaluations, the school system will conduct psychological evaluations for individuals who have disabilities of any sort. And we can get those records immediately or very quickly without much complications. So as soon as your loved one hits high school and you know that your loved one has a developmental disability and may need supports for the larger part of their lives, that is the best time to apply. So with that, that wraps up the application process for our IDD, and I will turn it back over to Middle Flint.
I believe that means it comes back to me. Sorry for that. We haven't at this time received any questions, but the Q&A live question feed is open and available at this time if you'd like to submit. I feel like a lot of the things that, you know, may have been questions, Valonda was great about covering some, and Dr. Faith was definitely exceptional about providing details on the vaccination process, and everybody gave a lot of great information today. So I'm hopeful that it helped provide more information about the program. If there's any questions.
Kerri, we don't have any questions in the Q&A at this time, but would it be okay if I ask a couple?
Absolutely.
I was just jotting down some things. I'm trying to think about questions that some of our family members, our communities may ask. Valonda, thank you. Dr. Pinnell and Ms. Roquemore, I'm so appreciative of you all. I think I learned something today, and I'm so appreciative of you sharing the information with us. I know what it's like to give up your Saturday morning, so trust me, I don't take that lightly, and I really appreciate you guys donating your time to us. Ms. Baldwin, if you don't mind, can you tell us what is a waiver service? What does that mean? What that verbiage?
Yes, can you hear me? Okay, great. Yes, a waiver service is essentially it's waiving the, I can go into this several ways, but essentially it is a service designed for individuals with intellectual and developmental disabilities to live, work, play, and thrive in the community setting with all of the supports that they need. And the reason why it is called waiver is because it is designed to waive the cost of what it would be for that individual to remain in an institutional-based care. So the cost that it would cost the individual or the state or whoever to provide those same services in an institutional setting, it will be provided in a community-based setting for the individual where they want to live closest to their chosen community. So that is the point of a waiver service. And the waiver service is designed to supply the individual with all of the supports that they need in order to thrive, to be safe, to have the supports they need to be as independent as possible in the community. And we have just one other thing I wanted to share. We have two waivers. DBHDD administrates two waivers. DCH, the Department of Community Health, is the Medicaid authority, and the Department of Behavioral Health the Department of Behavioral Health and Developmental Disabilities is the administrator of the new options waiver and the comprehensive waiver programs.
Thank you. That helps. That helps a lot. Is there a way for individuals to get any assistance with the application process or with the gathering of those important supporting documents? You're muted, Ms. Baldwin.
Sometimes we get questions from individuals or family members for individuals who are mature, I'll say mature, 55 and up. And by that time, school records are not available. Many times families don't know where to go to get the documents. And so what we do is we provide families with resources for where they can go to get the documents they need in order for the psychologist to make a determination of pre-eligibility. And that typically is the disability office, the Social Security office, DFACS for Medicaid eligibility. So those are places where we refer individuals for completing the application. We do not have a way to actually hands-on assist. We don't have the resources to actually hands-on assist with the application process, but we definitely refer to various resources for gathering the documents. And I just want to reiterate that the actual application is only 2 pages of demographic information. The majority or the comprehensive component of the IDD application are the supplemental records. So that is the thing that gets people the most. It's not the 2-page application, it's the supplemental records.
Thank you. Thank you. Dr. Pinnell, I know Clinic Drug is offering the vaccinations. Are there specific dates and times that individuals, and which vaccines? Is just the Pfizer, I'm pretty sure, that's available?
Thank you for asking, Angela. Can everyone hear me? Okay. I'm sorry, I should have covered that in my talk after Susanne addressed that she hoped she could get her next shot at clinic. But yes, we do stock both the Pfizer and Moderna vaccines. We do not have the Johnson & Johnson product at this time. In fact, I really don't know who does have that available in our community at this time. And we administer those shots every day. We have in the past week just cut down on the days that we administer the Moderna vaccine. We just kind of base that on demand. We hate to waste doses, so we try not to do that and schedule accordingly. But you can certainly just call the drugstore. We have both brands available. We administer them most days of the week and sometimes on Saturdays. So just call clinic.
Okay, thank you. That's awesome information. Ansley, can you talk a little bit about what PPE is available? You covered PPE that's available for staff to use, but are there options for individuals being served on the sites to access that PPE?
Yes, ma'am, absolutely. We offer the same PPE for clients if needed, and that would include, especially for our IDD population, if they have any type of sensory issues, that we can do face shields. We try to do less invasive masks. We actually have masks for the hard of hearing, which have a clear screen in the front so that lips can be read through the masks. And we are getting more and more PPE that is specific to particular individuals as the need arises. So anything, I try to stay up to date. If somebody comes to me and says, I have a deaf client that would like me to be able to read my lips, they can either use the face shields or the clear masks. And all of the PPE that we offer to staff is also available to our individuals.
Thank you. Kerri, I don't have any other questions. I am ready to throw it back at you. I'm not sure if there's any questions in the Q&A.
We have actually gotten a couple in. The first question is, you spoke about a potential day program addition to the North Campus for the IDD program. What phase of planning are we currently in for that program? And I would say the very baby initial phase. I've only been with Middle Flint for about 5 months now. So definitely something that we're trying to, plan, make sure that we understand, and have a good especially for me, have a good sense of the program and the existing services before we move into additional services. The second one, it looks like our IT specialist, Matthew, is responding to, can we get copies of the presentation? His response is, a recording of the presentation will be available early next week. And I do believe we've discussed this before. Middle Flint Behavioral Healthcare account was created on Facebook. And I believe that the live presentation will also be posted on our Middle Flint page. We also encourage everyone to go out there and like the page. We're hopeful in the future that it can provide more updates on the organization and kind of serve as a way to connect us with people in the community quicker. So another way for seeing it. Let's see. So another question's come in saying, for Miss Baldwin, what is your website again?
Okay, our website is dbhdd.georgia spelled out .gov, G-O-V. And what I can do is I can put it in the type in the chat box if that would be helpful.
I think that would be great. Another question has come through about our website. I believe we're in the process of refreshing our Middle Flint Behavioral Healthcare website, so it may temporarily be down just due to some updates that they're making within the website, but it should be available, if not today, maybe tomorrow or on Monday. Okay, so we got another question. Says, I'm interested in services for autism. Ms. Baldwin, where can we find the application again? I believe she's going to post the website for you to access, and it should be available under the IDD section of it, but I'll let her answer that.
Kerri, it's been added to the Q&A.
Perfect. Okay.
Okay, and I just wanted to verify, you were mentioning, the question was about the autism services or the application for the IDD services in general?
It was about autism, so maybe I spoke incorrect.
Okay. And that application, I'm sorry, that website will be it's in the PowerPoint.
Kerri, if you don't mind, I will take the question from Nicole.
Okay.
It is, what are some barriers for CAG without walls being provided within our agency? Right off the top, the biggest barrier is COVID-19. Being able to transport individuals out in the community to different spaces, as well as maintain their safety during COVID. Staffing is a second barrier. We are experiencing, as the rest of the world, we're experiencing a huge workforce shortage. And to move forward with providing those community access group services in the community will, especially during COVID, will require smaller groups of individuals together, which means more staff to separate and take those individuals out into the community. So those are the two biggest barriers at this time, COVID-19 and workforce shortages. But that's a great question, and thank you.
Okay. Thank you for answering that one, Angela. All right, well, it doesn't look like we've had any new questions come through. I greatly appreciate everyone's responses and sending questions in for those to be answered. We again want to thank you for your time and your attention during today's town hall session. And I'd like to take a moment and thank all of today's speakers for their time and assistance in making today's informational session a success. A special thank you to Elena Etheridge, a member of our Middle Flint team. Elena has been essential in compiling this information and a vital part to organizing the information today. I know a lot of information was provided during the last hour, and I hope it helps you understand more about our IDD service programs, about Middle Flint behavioral health care, and about ways to connect with DBHDD to obtain more information on future services. Hopefully today's session will be one of many that we'll continue to offer to ensure that our current individuals and future individuals seeking services will be updated with the most up-to-date information possible. Thank you, and I hope you have a wonderful afternoon and an amazing rest of your weekend.